COVID-19. But for the best protection against the coronavirus, we must wear and use our masks or cloth face coverings correctly. All persons over age 2 and who can remove their masks themselves should wear one. Before putting on your mask, clean your hands. Your nose and mouth should be covered with no gaps between the mask and your face. Do not touch the mask when wearing it. If you do, clean your hands immediately. Replace your mask when it's damp. Discard disposable masks immediately after use, or wash reusable masks frequently. When removing your mask, do not touch the front. Remove your mask from behind, discard, and immediately wash your hands. Let's protect each other from COVID-19 and wear our masks.
Good evening, Bermuda, and welcome to the members of the media who are with us today. I apologize for being a little bit late at our press conference today. However, I'm pleased to be joined by the Minister of Health, the Honorable Kim Wilson, who will be providing an update on the latest from her ministry. And following the Minister of Health, there will be the Minister of National Security, the Honorable Renee Ming, who will also give an update on matters under the Ministry of National Security. Following Minister Ming's, I will discuss the decisions of the cabinet meeting which took place on Tuesday, and also outline support that will be given to those employees and businesses who have been negatively impacted from the recent closures. First, Minister of Health. Minister.
Good afternoon. There were 1,397 test results received by the Ministry of Health since the last update, and 12 were positive for COVID-19. One of the new cases is classified as local transmission with known contact as associated with a known case. The remaining new cases are classified as under investigation. These cases are among residents with no currently identified links to either known cases or clusters or history of travel in the past 14 days. Additionally, 6 cases have recovered since the last update. Bermuda now has 497 total confirmed positive cases, and their status is as follows. There are 227 active cases, of which 224 are under public health monitoring and 3 are hospitalized with none in critical care. A total of 261 have recovered, and the total deceased remains at 9. The mean age of all confirmed positive cases is 44 years, with the median 40 years, and the age range is less than 1 year to 101 years. The mean age of all currently active cases is 35, and the median age is 31, and the age range is less than 5 years to 80 years. To protect the privacy and confidentiality, the average age and age range of the hospitalized persons will not be provided. The average age of all deceased cases is 74 years, and the age range is 57 to 91 years. The source of all cases is as follows. 140 are imported, 269 are classified as local transmission, of which 248 are local transmission with a known contact or source, and 21 are local transmission with an unknown contact and source, and 88 are under investigation. As investigations proceed, transmission categories may change. Today's update has 1 case moving from under investigation to imported. This case is a resident who arrived on Air Canada's Flight 942 from Toronto on the 4th of May, 2020, and tested positive on their day 8 test. An additional case has moved from under investigation to local transmission with a known contact as associated with a known case. The 7-day average of our real-time reproduction number is greater than 1, namely 1.67, and Bermuda's current country status remains at cluster of cases. We have received many calls to our mental health hotline asking, what are the coronavirus? World Health Organization. It states that the most common symptoms for COVID-19 are fever, dry cough, and fatigue. Other symptoms that are less common and may affect some persons include loss of taste or smell, nasal congestion, conjunctivitis, which is also known as red eye, sore throats, headache, muscle or joint pain, different types of skin rash, nausea and vomiting, nausea or vomiting, diarrhea, chills, or dizziness. Generally, anyone with 3 or more of these symptoms should please isolate and call their doctor, who can advise you regarding testing. Likewise, if your physician advises you that you are positive, isolate and prepare a list of your close contacts for epidemiology and surveillance unit. As mentioned in yesterday's release, since early on in this pandemic, our care homes have been working hard to keep our elders and vulnerable persons safe. Shielding requirements resulted in a restriction preventing staff from working at multiple homes. This vital intervention has remained in place. However, in part due to this, homes are struggling to find qualified staff. In particular, registered nursing associates and registered nurses are needed by many homes. We are trying to assist the homes in their ongoing search for staff. And for this purpose, if you are a registered nursing associate or registered nurse and have interest or experience in care home work, please email your resume to covid19resumes@gov.bm. Please note, anyone who sends a resume to this address starting tomorrow will have their resume shared with and forwarded to care homes as appropriate. If you do not want your resume forwarded to care homes, you must state this when you email it. Please note that covid19resumes@gov.bm remains the location to send your resume for the government's COVID-19 related staffing needs. At this time, we are also appealing to family and friends of care home residents to work with the homes to find creative ways to maintain connection with their loved ones whilst visiting restrictions are in place. Please remember that the scheduling, frequency, and types of visits possible are not only set by government guidance and restrictions, but also by the home's ability to accommodate such, which includes having sufficient staffing levels. Also, I would like to take this opportunity to repeat and further clarify the information that was released yesterday regarding employers asking employees for COVID-19 test results. The Ministry of Health has received a number of questions about when an employer can ask an employee While the ministry is not in a position to provide legal advice to an employer, each employer should seek his or her own, especially as it relates to their obligations under the Occupation Safety and Health Act of 1982. The public is reminded that test results are considered personal health information, and as such, they can only be shared by an employee if that employee wishes to do so. Ministry guidelines do not state that employees are required to provide a negative test to their employer to come to work. But with that said, the ministry can also confirm that a person who knows or has reasonable cause to believe that he or she has a communicable disease, such as COVID-19, and who exposes other persons to that disease commits an offense pursuant to the Public Health Act 1949. And it is also an offense to carry on working in such a circumstance. There is a balance to be struck, and the legal obligations are real. When a confirmed case is identified, the contact tracing team and environmental health will conduct a risk assessment on the place of employment. As part of the process, the Ministry of Health teams will be able to identify and isolate people in the organization who have had direct contact with the confirmed case. The Ministry of Health team will also advise an organization if they have to be closed for a period of time for deep cleaning, or if any adjustments to their workplace protocols are recommended. We are still receiving many queries from people who have been in contact with a close contact of someone who has tested positive for COVID-19, or perhaps they work in the same office but not in the same work area as a positive case. Now, these concerns, although understandably justified, are leading to non-science-based decisions regarding quarantine. Again, I want to stress that it is the Epidemiology and Surveillance Unit who will be in touch with you if they feel that you have been at risk of exposure. I would again ask that workplaces please not make decisions in place of the Epidemiology and Surveillance Unit. It is not helping, and it is leading to increased demands for testing appointments by people who are not immediately in need of a test. Again, if you are identified as a close contact and asked to quarantine, you need only quarantine if you have been advised to do so by the Ministry of Health's Epidemiology and Surveillance Unit. not by the advice of your neighbor, not the advice of your work coworker, not the advice of your family member, and not the advice of your employer, only the epidemiology and surveillance unit's advice. ESU will provide you with those instructions regarding quarantine if and only if they apply to you. If you are asked to quarantine as a result of an exposure to a positive case, again, asked by the epidemiology and surveillance unit, please do not apply the quarantine guidelines that travelers follow. These are two separate quarantine and testing regimes, and the difference is that travelers are not considered confirmed positive cases. For workplaces, we are finding that employers are making the decision to close their establishments and possibly quarantine employees without pay, even though they have not been notified by the health teams that they must do this. We recognize that it is the employer's choice to make, but acknowledge also that these decisions create hardship for many employees. In addition, they result in a lot of understandable concerns on the part of the worried well and casual contacts, which requires significant time and resources on the part of the health teams to unravel. In summary, I ask employers and employees to follow public health guidance, as each case, each circumstance is different, and where it is necessary, follow the advice of legal counsel. In closing, I would like to briefly cover two issues which we have received many queries on over the past several days. The first one is we've received a number of questions regarding the British Airways crew member who recently tested positive. It is not our policy to discuss individual cases. This is confidential information. However, the epidemiology and surveillance unit has completed a risk assessment and have provided the additional information and guidance to those persons who required it, and all appropriate public health guidelines have been followed. And I also want to remind the public that the Quarantine COVID-19 number 3 Amendment number 7 Order 2020 was gazetted today, and therefore with effect from tomorrow, those arriving without a $300 fee, and this fee will be assessed at the airport upon arrival. Thank you.
Thank you, Minister of Health. And certainly thank you to your teams for all the work of which they've been doing over the last few weeks. Next, we'll hear from Minister Ming, who will be giving an update on matters surrounding the Ministry of National Security. Minister, the country awaits your update.
Good evening, Bermuda. I wish to begin by speaking to matters to do with the Department of Corrections. This evening, the Ministry of National Security can advise that there are confirmed positive cases within the Department of Corrections. I can also confirm that all persons have been tested. The positive cases have been isolated, and I can assure the community that all the necessary health protocols and recommendations are being followed in accordance with guidance from the Department of Health. I want to stress this evening that the health and safety of the officers, staff, and inmates at the Department of Corrections is our paramount concern. Development, I want to ensure the public that we are taking all of the necessary actions and precautions to ensure that those who work and reside at our correctional facilities are safeguarded and protected from the COVID-19 virus. As a note, the Department of Corrections has a specialized response team that is focused on dealing with the COVID-19 pandemic. The team is tasked with ensuring that any risks associated with COVID-19 are mitigated in accordance with the department's pandemic plan. I want to take this opportunity to commend our staff for working diligently under stressful conditions throughout this pandemic. We will continue to closely monitor the risk levels and put measures in place to ensure the well-being of all. Switching to public safety. Earlier this week, I addressed the recent crime-related incidents in the East End, which were cause for some of the concern of our entire community. I'm referring to the home invasion and the vehicle fires. As I said in my recent public comments, few acts of crime can be more frightening than to have the safety and peace of one's home violently disturbed by someone brandishing a gun. I can certainly empathize with the angst and anxiety that our community is currently feeling. After 10 months of dealing with the COVID-19 pandemic, which has brought its stresses that all of Bermuda is challenged with, The incidents of the past few days are quite disheartening. This evening, I can offer the following update as it relates to the investigation into these incidents. On Monday, December the 14th, I had the opportunity to discuss last weekend's home invasion and firearm incident with the Bermuda Police Service and the gang violence coordinator. The BPS are treating the armed invasion as an attempted murder incident. As of today, I can report that the Serious Crime Unit is actively progressing investigations into recent events in St. George's, including the spate of car fires. The team is confident that a court appearance in the attempted murder incident is likely in the near future, and the BPS is working with the Director of Public Prosecutions in this regard. I wish to assure our community these lawless acts by a few are being dealt with by those who are working around the clock to keep our communities safe. In that regard, I wish to commend the Bermuda Police Service for working swiftly to arrest those responsible, as well as the Bermuda Fire and Rescue Service for their efforts in extinguishing the vehicle fires. As we turn our attention to ensuring the community's compliance of the updated COVID-19 regulations, I wish to advise that the Bermuda Police Service's COVID compliance team continue to be active in visiting various businesses, bars, and restaurants to ensure that patrons and establishments are engaging in the appropriate health and safety protocols. In addition to checking in on those licensed premises that remain open, the team is also making night visits to ensure that the businesses and patrons are complying with the current curfew regulations in place. Additionally, next week, the BPS will begin conducting their road sobriety checkpoints. These will take place over Christmas and the New Year periods. So, we are urging the public to be mindful and make sensible choices. In conjunction with the Bermuda Fire and Rescue Services remit, I would like to take this opportunity to remind everyone of some safety tips over the Christmas period. Test your smoke alarms. Water live trees on a regular basis. Place Christmas trees away from sources of heat. Keep lit candles away from decorations and other materials that can burn, and blow them out before leaving the room, home, or going to bed. Do not burn Christmas tree branches or wrapping paper in fireplaces. Do not overload electrical outlets. Utilize surge protectors. Lastly, as always, I wish to encourage our community to please exercise personal responsibility and common sense over this holiday period. While we understand that this is typically the time of the year for hosting seasonal gatherings and house hopping, we simply cannot engage in this type of behavior this year for obvious reasons. As the Premier and the Minister of Health have said repeatedly, please continue to keep your family and friend bubbles small. Please continue to follow the health guidelines to protect you and your families. And finally, if you are in attendance at any establishment or location around the island and see any breaches of the COVID-19 regulations by persons or businesses, please do not hesitate to call 211 to report the violations. Thank you.
Thank you, Minister Ming. As we enter the season of celebration, one that normally involves dining out, socializing, and shopping, we are painfully aware that the protocols employed to counteract the virus have caused challenges in the economy. For retail businesses, a bumper Christmas shopping period can make up for weeks or even months of slower sales. For businesses like in-home bakeries, Christmas represents their busiest period of the year. Making puddings, mincemeat tarts, fruitcakes, farine pies, and many other delectable Bermudian treats generates much-needed income, especially for seniors who are the guardians of old, treasured, delicious Bermudian recipes. Spending our time with family and loved ones, sharing our time with neighbors and those in need, and giving our time to help churches, organizations, and people who can. Time is the one gift that we all can give, and at the end of an unprecedented and challenging year, We all need to know that someone is thinking of us and someone cares enough to spend some time on us. Since this recent surge began, our teams at the Ministry of Health have been working flat out and literally around the clock to control this current outbreak. They have gone above and beyond and certainly have given and sacrificed their time for the country. The scale of numbers over the past few weeks have been frightening, and it has required the coordinated efforts of many to control this outbreak. The steps of which we have taken thus far are working. We are testing more people than ever before. Our numbers, while still too high, are falling. Our R number for today has now fallen below 1. However, our 7-day average is still higher than where it needs to be, well above 1. The reality is that this outbreak is not yet fully contained. And the cabinet, with that knowledge and following the advice of the Minister of Health, has agreed to extend the current restrictions in place for another 2 weeks from December 22nd through to January 4th. This is certainly not the news that anyone wanted to hear, and it is not the news that I wish to deliver. But it is vital that we get full control of this outbreak so that we can return to a place where our virus management was envied. There may be some minor changes which will be detailed at next week's press conference. However, in the main, the restrictions must stay in place for 2 more weeks. A hasty exit from the restrictions could lead to us having to reimpose restrictions at a later date, and that is not something that any members of the government wish to do. We are actively managing the coronavirus, but I cannot stress how vital it is that we each do our part. The measures that we deployed have been targeted and they have been effective. However, we must continue to do the things that we've become used to: physical distance, wearing masks, sanitizing our hands, and downloading the WeHealth Bermuda app. If we do all of these things, we will get this outbreak under control. There is no reason why we cannot emerge from this period of restriction. However, it is essential that we cooperate with one another, cooperate with contact tracers, quarantine if advised, get tested if directed. As I have said, we all have a role to play, and it will require all of us doing what is necessary in order to ensure that we can fully control this current outbreak. With the news of an extension to restrictions, many will ask about the support that will be extended to those who are unable to work from home and whose businesses may be affected. Assistance to those affected will be extended, and those who have been approved for benefits or who have applied and will be approved for benefits will receive a second 2-week benefit. Assistance payments went out yesterday, and should we not yet receive your payment, you can go onto gov.bm. At the bright red bar up top, there is a link where you can go ahead and apply for the unemployment benefit, which covers those persons who have been required to quarantine, who are unable to work from home by the Ministry of Health, or those persons who have been directly impacted because their place of employment has closed. In addition to the assistance to individuals affected, the government has also worked with Bermuda Economic Development Corporation to deliver assistance to business. During a press conference held yesterday afternoon, the executive director of the Bermuda Economic Development Corporation, Ms. Erica Smith, announced that $1 million has been set aside to provide emergency grant relief for the businesses that have been impacted by mandatory closure and quarantine notices. The funding will provide financial support to businesses that are members of the BEDC, such as bars, nightclubs, members, clubs, and restaurants. The emergency grant will assist with the payment of businesses' rent, utilities, social insurance, and health insurance premiums for their employees. To apply for the emergency grant, visit bedc.bm and complete the application. The grant given can range from $5,000 to $7,000, depending on the size of the business defined by its annual revenue generated over the last 12 months. The amounts of funds allocated will also be determined by invoices and bills as part of the application process. The BDC is working hard to make sure that the businesses that need the funds receive those funds. They have expanded the existing COVID-19 Business Continuity and Sustainability Funding Program, which was launched in April. This program has been expanded, and the BDC will consider all requests for financial support, including stimulus and innovative businesses ideas, and will use the available funds to support more small businesses that are in need. Small and medium-sized businesses are vital to Bermuda's economy, and as a country, we have to do all we can as the economy grows. The government is happy to support these businesses and thanks the team at the Bermuda Economic Development Corporation for their continued work to support small and medium-sized businesses in Bermuda. I would like to touch on an announcement that was made at a recent press conference regarding the Cocoa Reef Hotel. The Cocoa Reef Hotel is offering a special rate of $79 per night, plus applicable fees for residents who cannot quarantine at their homes. This rate is based upon an 8-night stay and only available for returning residents who are required to quarantine. I will now move to the We Health Bermuda app. As of this morning, almost 16,000 people have downloaded the We Health Bermuda smartphone app. This means that almost a quarter of the entire island, which includes adults and children, have downloaded the app. This is a very good start, but we must do more. And I urge you, those of you who have not done so, to please download it. It is very simple. Just go to your app store and search for We Health Bermuda. Our families, our neighbors, our community, our small business depends on us to prevent the spread of the coronavirus. This app will help by providing the anonymous exposure notifications to those who were close enough for long enough to potentially been exposed to those who tested positive for the coronavirus. As a reminder, when a person received a positive confirmation, they will be given a randomized and anonymous code by the Ministry of Health. That person will then need to enter the code into the app on their phone in order for We Health to anonymously notify other We Health Bermuda app users. The We Health Bermuda app does not collect personal information, nor does it track users' locations, and these notifications will be completely anonymous. The technology behind We Health has been designed to specifically protect app users' privacy and their identities. Instead of using personal identifiable information, the app uses Bluetooth signals to measure how long and how close app users were together. These signals do not carry identifiable data or information, nor do they track your location. And your the We Health Bermuda app ensures that your identity stays completely anonymous. And that is the reason why it requires the user to enter the information and access that information. I downloaded the app on my phone during the testing stage, and since I have downloaded it, I have not had anything to do except for to keep my phone running. Once it is installed on your phone, there is nothing else to do. It works in the background. I want to again thank everyone who has worked to make this launch a success. And if you have questions about this app, please visit gov.bm/wehealth, or you may send an email to covidapps@gov.bm. We all look forward to celebrating the holidays. And while this year our celebrations will be different, as family groupings may be smaller, we won't visit each other's homes as we normally would. Dropping off gifts may be just that, leaving them on the porch or by the kitchen door. The goal for this holiday season is to ensure not to get together with their friends as they normally would at this time of year, especially those who have returned home already and those who are looking to return this weekend. The temptation is to go and hang out with those you haven't seen since the summer. Don't. The simple message is assume every person with whom you're interacting with could be a carrier of the coronavirus. Do not think only about yourself, as you may be fine, but consider the vulnerable. Consider your parents, consider your grandparents, or consider your great-grandparents. The coronavirus spreads asymptomatically. People who are not sick, who feel absolutely nothing, can transmit this disease to those who can get very sick and require hospital care and may succumb to the symptoms of this virus. I urge everyone to please keep this in mind, that it is a critical time. And those of you who may be returning, or those of you who may be tempted to hang out, please do not. And parents and grandparents and families, it's time for us to collectively make sure that we do not allow this behavior to happen, as it could put your families at risk. There are many in our community who are experiencing high levels of stress due to the impact of the pandemic. We are all facing high levels of stress, and if you need help and someone to talk with, help is available. Call the Emotional Wellbeing Hotline on 543-1111, and someone will be there to help you. The next COVID-19 press conference will take place next Tuesday, December 22nd at 5:45 p.m., where, as I indicated, full specifics will be provided on the extension to the current restrictions. Before I take questions from the media, I would just like to wish my beautiful daughter Nia a very happy 6th birthday and to let her know that Daddy will be home soon to celebrate. Thank you. With that, I will take questions from the media.
Good evening, all. Thanks for having us. Jonathan Bell from the Raw Gazette. Mr. Premier, or maybe Minister of Health might be able to help us with this one. We've had a conversation with U.S. Consul Lee Rizzuto, who's saying he's anxious to help us out secure enough vaccines. And we wondered what discussions the government or the health ministry may have had with the U.S. consulate.
I can yield to the Premier. This is with respect to acquiring the vaccines. I'm sorry, was this?
The
Discussions with
quote
the US
from him is
Consul.
saying, to end the year with one more project, it is our goal to see how we can help Bermuda secure enough vaccines for the entire country. Mr. Rizzuto evidently hoping to help us out there.
Okay, I can yield to the Premier because actually, Ministry of Health, we don't necessarily have direct liaisons with the U.S. Consul General. However, as I've indicated previously, Bermuda has explored 2 routes with respect to the acquisition of the vaccine. One is through Government House and through the Foreign and Commonwealth Office in the UK, who are providing a proportionate supply of vaccines to which they acquire to all of the OTCs, the ones that have the proper refrigeration and so forth, and Bermuda being one of those countries. And then likewise, through the COVAX facility, we have paid the requisite fees so that when that those vaccines are made available. I actually have some good news. I was on a conference call today, and it seems that we will likely be receiving the Pfizer vaccines by the end of the first week of January.
Thank you, ma'am. Second one is in terms of track and trace resources. We've had a lot of these active cases that are under investigation. I wanted to know, just have we added more people to that team, and to what number of people? What's the size of the team, and have they been able to get more folks to assist with, what was it, like 80?
I don't have the
working?
exact number, Jonathan, but I've met quite a number of people in recent days, actually, that have just come on board that are contact tracing. In fact, one young, bright woman I met yesterday evening is actually finishing her master's degree in psychology, so she has the requisite counseling skills that will assist her, because there is a degree of counseling when you're speaking to persons concerning this particular issue. But we have upped our ante, so to speak, and there have been a number of persons that have been recently retained to provide that added support for the contact tracing team.
Oh. Maybe reporters can help out.
I can hardly hear you, Jonathan. I'm sorry. What did he say?
Okay. The third one, this is going back to where we had homeless people being sheltered at Cedar Bridge. That was a different time, obviously, but we wanted to know just what was happening. We have a curfew, and it's extended with the unsheltered population.
I'm happy to answer that. Happy to answer that question. This is certainly an issue that has come up, that has been discussed at the current place where we are right now. We're working with the existing helping agencies who provide services for the homeless to make sure that situations are safe there and effective. At this time, there has not been a conversation discussion to reopen the shelter. However, all possibilities are being explored.
Thank you, sir. Number 4, this is to do with, we've heard is that a staff member at the hospital, the food service, tested positive this week. I guess, can we confirm it and see just how we managed to deal with that? Obviously, there've been a few cases from the hospital. This is within the food department. I guess that's to yourself, Minister of Health.
Actually, it would be more appropriately addressed to BHB, and I'm not in a position to confirm or deny what position there are with respect to cases. I think you should address that directly with BHB.
Righto. Number 5, we've been hearing a lot about young people. I put this question in a couple of days ago, so I wouldn't spring it on you, but we were hoping to hear if there's out of the recent time, a set of days that you could tell us about the number of those proportions of people who tested positive for age 18 and younger. Hopefully not something that intrudes on privacy, but gives an indication of just how many there are.
Right, and again, I respect that you respect the importance of privacy for individuals, but I can say that of the recent cases and spikes that we've been speaking about in recent weeks, that there are, of those persons age 18 and under, there are 25.
Righto, thank you. I guess last one, in terms of clusters, how many are there? And at the moment, 7 was the last we heard, and perhaps maybe, I know it's gatherings, but gatherings versus workplace, you might be able to fill us in on?
As you rightly said, there are approximately 7 clusters. However, we're now trying to steer away from utilizing that word because we're seeing a number of subclusters that are developing, some within workplaces and some in other social settings, but they all roads lead, so to speak, to 2 principal clusters. One that you've heard me speak about quite a lot recent days, and then a second one that's happened actually that same weekend. So the commonality is that when some of the cases that we're picking up today and yesterday and in recent days, when we start the contact tracing, we're able to direct them right back to those events that took place at the last weekend of November.
Oh, I see. Thank you kindly.
Thank you.
Good evening, Tom Burgess, Bermuda Broadcasting. We are witnessing vaccines being given to citizens in multiple countries such as the UK, USA, Canada, China, Russia, UAE, etc. Bermuda is going to be a month behind those other first world and even developing countries in getting the vaccine. Bermuda is an overseas territory and a first world country. Why didn't Bermuda get the vaccine at the same time as the rest of the UK?
I think that's a question that you would rightly have to ask the UK. They did indicate that they would, and I'm not trying to be flippant, but they did indicate that they would provide the same proportion of vaccines that they acquire to the OTCs. So we have relied on that. But in the interim, notwithstanding that discussion was taking place, we also secured through the COVAX facility the ability to purchase vaccines when they become available. I think that we would like to have received the vaccines 2 weeks ago when the United Kingdom did. I think it still is a mammoth feat that we'll be able to have by the first week of January vaccines here in Bermuda and start the distribution of our vaccine rollout plan.
Bermuda will have vaccines before most countries in the world, Dawn, and I think your question is a little bit unfair.
I'm sorry, I missed the last part.
Bermuda will have vaccines before most countries in the world, a significant majority of the countries. And I think that your question is unfair.
Okay. 2, Health Minister, on Monday night, you said the International Air Transport Association would be requiring travelers to have a vaccine in order to travel, but on the IATA website, it states that it'd be up to the individual countries. How do you reconcile that with what you said?
I'm just going to go to what I said, which was, thank you, Don, that and I must repeat this because this is so important because people have been asking this question. This was in my ministerial statement that I gave to the House, which would be in the public domain on Friday, the 13th of December. And I'm quoting, if you don't mind. Mr. Speaker, COVID-19 vaccination will be voluntary, but it is already clear that the travel industry is likely to make evidence of immunity by vaccination as a requirement for crossing international borders. And then I proceed, indeed, IATA, or the International Air Transport Association, has already started to create a vaccine passport for pilots and crew of airlines and as part of their future plans. We can't speak for IATA, and if we already have known from public sources that there's one particular well-known airline that has already indicated that they will not allow persons to board in the absence of having a COVID vaccination. Maybe other airlines will follow. I can't speak to that, but what I can speak to, and I think it's incredibly important for members of the press and particularly members of this community to appreciate, we do not intend as a government to make COVID-19 vaccinations mandatory. Measles vaccinations are not mandatory. So we're certainly not making COVID-19 vaccinations mandatory. But what other airlines do, if other airlines choose to follow the example of Qantas, I'm not sure, perhaps the Minister of Tourism who sits to my left could perhaps elaborate on that more. I can't comment on that, but what I can comment is that we will not make COVID-19 vaccinations mandatory. But what we will do is have sufficient supply for everybody that wants it to have it.
I think IATA came out after Qantas said that they were going to require it, that they actually condemned them for doing it because it was too early.
Okay.
Well, I would say this, that each individual airline will make their decisions and each individual country will make their decisions. I recognize certainly that the Minister of Health has made it clear what she said in her original ministerial statement on Friday last week. I recognize that her comments on Monday have created a lot of, I would say, chatter and confusion. But the fact remains, from the government of Bermuda's perspective, and this is a singular line item, that there is no mandatory vaccination in Bermuda. There is no mandatory vaccinations planned in Bermuda, but our intent, as the Minister of Health said very clearly, is to make sure that we have vaccines available so anyone who wishes to get vaccinated will have the ability to be vaccinated. We are far from the road where it is going to be determined when other countries, when vaccines are widely available and every single person has access to it, what those controls or restrictions may or may not be imposed by other countries on international travel. But it is clear that right now, if you want to go to certain places, though Bermuda government will not require you to get a vaccine for yellow fever or dengue fever or measles, mumps, and rubella or other things, if you go to certain countries, they'll require you to evidence that you have those vaccinations. So as we say, this is a space that we'll have to watch, but the best and bottom line on this, Don, is very simple. There is no plan for mandatory vaccination, and that is all persons who fear that I'm going to require them to get a jab need to know. There is no plan for mandatory vaccinations, and the government has been clear and consistent on that at every single press conference that we've had for the last 4 months.
Okay, thank you. Mr. Premier, Bermuda just opened the new airport terminal, but many people have taken your advice and not gone overseas, and the health minister's advice as well, not gone overseas for shopping this holiday season and have ordered online instead. We've heard for months about lengthy delays in clearing air freight packages that are getting stuck at customs. Will there be a fix next week, if only temporary, so that Santa Claus can arrive in Bermuda and children can get their presents on Christmas Day?
I think I can answer that question, Don. And actually, tomorrow we have a press conference planned with a customs representative so that we can shed some light to the public on any delays and any ideas for speeding up the process in terms of what the customs process is and what you can do to ensure that your packages aren't delayed.
All right, thank you very much.
You're welcome.
Mr. Premier, a Bermudian went to Johns Hopkins this week and tried to get a test done at Costco in Baltimore, and they were told that they couldn't because Maryland's health insurance protection laws are stricter than the rest of the United States. They were then told that they could book an appointment at the Baltimore Convention Center where they're doing the testing. But the earliest testing was the 21st for them, which would be too late for them to get on a flight back to Bermuda. Will this person have to pay the $300 reentry fee back to the island?
The requirement is for any resident who returns to the country without a pretest will be required to pay said fee. In regards to the individual matter of which you've raised, I would encourage that person to contact either myself or the Bermuda Tourism Authority so we can look into that issue.
All right, thank you.
Good evening, Premier, Ministers, Trevor Lindsay, TNN News. Minister of National Security, you did confirm the cases at Westgate. You didn't state the amount of individuals, inmates / officers that are positive for the coronavirus. Can you indicate how many?
Trevor, I actually don't have the number in front of me right now, but I'm kind of concerned that there's some sensitivities around that number, but unfortunately, I don't have it right now, and I will see what's the sensitivity around us actually releasing that information.
But there's a high level of anxiety amongst inmates at present and officers. Word that I received today, and as we speak, another 2 inmates were confirmed positive, as you just gave the information. So it would be prudent for you to calm these families of all involved. What do you think?
Surely, and what I can say, Trevor, I think it's more important for the families to know that we are doing everything in accordance to the Department of Health guidance, and that we are taking the necessary actions and precautions to ensure that those persons who work and live and reside, at the correctional facilities are safeguarded and protected from COVID-19.
Thank you. Minister of Health, you've moments ago required for nurses as people with certification to apply at a specific number. I've got one individual here just hit me up as you said it, said that she's received a degree, she has her license and her certification, has applied, emailed twice, and never had a response. Other college students that are applying for nurses aid are not being adhered to. What must they do?
I would invite her to send that email to that particular address that I mentioned this afternoon, and then also she can send it to me as well. Copy me in on that email, and I'll give you my email address: knwilson@gov.bm.
Thank you. I'm sure she's listening.
Okay.
Next question: what is the protocol for staff or persons, for one reason or another, that have been quarantined to return to work? Well, earlier you stated that, and I'm sure Premier, you made the announcement about employers and employees not disclosing to their employers the results. I know one facility for a fact. How do I ask this question? Is there another way around this?
What's the question?
The question is reference to employees disclosing personal information to their employers. I guess if they're positive, the Office of the Health Department will notify their employees, but if
That's
not,
the answer.
Sorry?
That's the answer. If they're positive, the ministry will notify. I think the minister covered that rather extensively in her statements, but you can ask the question again. Maybe she might be able to clarify.
So what it is that individuals have been off for 14 days and waiting for results, don't get those results, and employers are calling. This process seems to be going rather slow. What does these individuals do? What will one do when the process is moving too slow and employers are calling?
Trevor, I'm not 100% I'm following you, so forgive me. Do you mind restating the question? I thought you were speaking about a person that was placed in quarantine and whether or not they need to inform their employers. And then you spoke about the testing. So if you just,
So I guess it's a two-part then.
okay.
Yeah. Employers are asking for results.
All right.
Monday it was stated, you don't have to necessarily tell your employers what your results, especially if it's negative. But for two individuals I know, they cannot come to work until they produce the results. And the indication is that the premier says that they don't have to disclose that information. Is it correct?
Well, the employee, let's assume it's the employee that is a positive case. They are not required to produce their result, as I indicated in my statement. However, again, there is the Occupation and Safety Act that also has to be put into consideration. So it's effectively a balancing act between the Occupational Safety Act as well as the employee's right to privacy, because that is their personal health information. And in the ordinary course of things, when a person tests positive and the contact tracing team starts the process, they will speak to the employee and they have to do a risk assessment, because there may be circumstances where it is necessary for the employer to know, because perhaps it's a mass outbreak and that they have to, but they always invite the employee first to explain to the employer their circumstance. We don't provide that information. We invite them to do so first, because it is private health information, which, as you can appreciate, why I'm always so guarded when questions are asked about individual cases, because it's their private health circumstances.
If anyone is experiencing a challenge with this and an employer who is requesting things outside of the law, requesting private and personal information which they're not entitled to receive, they should contact the Department of Labor for action.
Good stuff. My last question. We have at present some airlines that are being snow on the East Coast. Flights are going to be delayed. One flight was due to come in tomorrow. They're going to be stuck until Saturday. The individual has asked, they have a pretest. They have already negative on the pretest, and they're not due to land until Saturday. Are they going to be still quarantined? What happens with their pretest stipulations? Does that cancel out what they've already done?
Are they a resident? Do you know, Trevor?
A resident, yes.
It's a resident. Okay. Well, what I would suggest that they do is they could probably, through that same email, send me a note, because we can make circumstances. I mean, we can adjust the requirements based on circumstances of travel. And if they're able to confirm, which they no doubt will be able to, that their flight has been delayed, then we can make amendments to the TA so that they can land and utilize the test, because they're going to be tested upon arrival anyway. And those are rare circumstances, but we can make accommodations, so they can send me the email.
So the $300 that is required is not going to have to be, and that's what they're asking. Do they still have to pay the $300 because they already got a pretest, which I guess would expire tomorrow because she was due to land tomorrow?
Right. And you're saying her flight has been delayed?
Yes, the flight has been due to snow on the East Coast. So they're not coming in tomorrow. They're coming in on Saturday.
Okay. I would just invite that person to contact me.
Thank you much.
Okay.
All right. Thank you, members of the media, for your questions. Thanks for the attendance to the Minister of Health and the Minister of National Security, and the continued work that all members of the government are continuing to do during this difficult time. We'll see you again next week, Tuesday, December 22nd, to provide further updates and to lay out specifics regarding the required extension to the current restrictions which are in place. Thank you very much for your attention. Thank you, Bermuda, and good evening.